If I were in class, I would ask, what diseases do you know of? And people would yell out a whole bunch of stuff that I've probably never heard of. Kidding. People say things like lymphoma, leukemia, thalassemia, sickle cell anemia, pernicious, iron deficient. We're going to cover all of these. But we're going to focus on anemia, which all anemias have to do with red blood cells and ultimately your ability to carry oxygen. Next, I would ask the class, what are some of the characteristics of blood that you know? And someone will probably yell out, it's thicker than water, which is true. And this is called viscosity, which means resistance to flow. Blood flows much more slowly than water, right? Similar to ketchup or maple. Well, no, it's not that thick, but it's definitely more viscous than water. Others might say it tastes like metal, which it does, due to a protein called hemoglobin, which is the protein in blood that contains iron. Some might note that blood is red. Hey, good observation. And they'll also mention that it appears dark red or ruby red, depending on whether it has oxygen bound to it or not. In textbooks, you usually see systemic circuit diagrams, like this one here, of the person that looks like they have no head, kind of. And these diagrams will show arteries as red, containing oxygenated blood, which you see on the left side of this person here, and veins as blue, containing deoxygenated blood. And something that's not listed here are capillaries, which is where exchange happens. And so these are sometimes, well, usually they're purple. However, the blood in your veins is not blue. This color coding is a teaching tool. In the systemic circuit, arteries carry oxygen-rich blood and have ruby red blood. In the systemic circuit, veins carry deoxygenated blood and have like a brick red blood. In the pulmonary circuit, which is the circuit that is not our default circuit to learn about in this chapter, but in the pulmonary circuit, the colors are reversed. Right? In the pulmonary circuit, arteries are carrying deoxygenated to the lungs, right? Because that's the purpose of the lungs, is to take the oxygenated blood and put oxygen on it. So in the pulmonary circuit, veins that are carrying blood back to the heart are carrying oxygenated blood back to the heart. Remember, the colors do not signify artery and vein always, right? The colors just tell you if the vessel is carrying oxygenated or deoxygenated blood. Recall that any connective tissue is basically just a bunch of cells suspended in a gooey substance, much like gelatin. Similar to this disgusting fruit mold over here, the fruit pieces would be like specialized cells, like red blood cells, white blood cells, and the gelatin would be the matrix of this connective tissue. Remember that matrix is composed of a ground substance, which is usually water, and proteins like collagen, elastin, and reticular proteins. Blood and lymph are fluid connective tissues. And so, although these three terms still apply, they're applied in a little bit of like special circumstances. Like these apply asterisk. Instead of calling things cells in blood, we call them formed elements. And this is because some people do not consider red blood cells to be fully functional cells. They lack a nucleus. Other people don't consider platelets to be full cells. I don't think they are, since, I mean, technically they are fragments of a cell that's kind of like exploded. So we say that blood has formed elements instead of specialized cells. As far as the ground substance, it is just water. I mean, it's water, just water, like not like water and something else, just water. But contained in this water are a bunch of nutrients, a bunch of ions, a bunch of plasma proteins. And this abundance of proteins is an exception to the normally found three proteins in connective tissue: collagen, elastin, and reticular fibers, kind of like as we see in dense connective tissue or even in bone. But here in blood, we don't have to have those three proteins, here in blood, we consider the plasma proteins to fit that criteria of a connective tissue. So blood is a fluid connective tissue consisting of specialized cells, red blood cells, white blood cells, platelets, plasma proteins, and water as its ground substance. When looking at a histological slide of blood, you will never see anything other than those specialized cells. You can see red blood cells, which sometimes look like little Cheerios. White blood cells are much larger, as you can see in this picture, and the little tiny purple dots are platelets. Whole blood is a very specific term, and I need you to start using it. I need to use it more. What you see in the test tube on the left here can refer to or be referred to as blood, right? You might say, oh, that's a test tube of blood. However, the technical term is whole blood. And this would be similar to calling these cells over here white blood cells when their technical term is leukocytes. We also have red blood cells, and their technical term is erythrocyte. When you say whole blood to me, I think of all of these components: leukocytes, erythrocytes, and platelets, and plasma. And this makes a big difference because not all of these components are given to patients when they need blood transfusions. What's in the bag depends on what the patient needs. If we were to centrifuge or swish around really, really fast this test tube of whole blood, we'd see these three different layers that separate out by density. The lightest component is that yellowish substance called plasma. The white band in the center is called the buffy coat, and it contains our leukocytes and platelets. And I guess I should mention that the official word for platelet is thrombocytes, but nobody really uses that. We also have this big portion of red blood cells, officially called erythrocytes. So when you use the term whole blood in this class, I know that you are referring to a test tube that contains all of these components. However, when you're referring to the oxygen carrying capacity of blood, which is the focus for us here in this chapter, you should be referring to the oxygen carrying capacity of the erythrocytes in whole blood, because the other components of whole blood don't carry oxygen. So when you refer to your blood's ability to fight infection, you're referring to the leukocytes present in this whole blood. The blood bag to the right, that's obviously full of plasma, right, containing that yellowish straw color from albumin. However, the two blood bags on the left, they look deceptively similar. One contains whole blood, indicating that there are leukocytes, there's plasma, platelets, and the other one contains only red blood cells soaking in an isotonic solution that kind of mimics plasma. So a bag containing only red blood cells is usually referred to by its packed cell volume, PCVs. But using this term, we're saying that what's in the bag is only erythrocytes in an isotonic solution. So this slide makes very clear why you cannot use the word just blood in this class. You need to refer to whole blood, or more specifically, to one or more of the components in blood.